So good evening, everybody. Thank you so much for coming out. My name is Parris Washington, and I'm currently a fourth year PhD candidate at Johns Hopkins University in the lab of Seth Blackshaw.
And my name is Dr. Maya Drummond. I'm a physical therapist at MedStar Health in Washington, D.C. And our project, as Janine said, was addressing health disparity through health literacy. So for those of you who aren't familiar with the term health literacy describes an individual's ability to understand and process basic health information and use that information to make the best decisions for themselves and their dependents. So this project really has its origins back when I was in grad school for physical therapy a few years ago. And while I expected to learn how to be a good clinician, I didn't expect how to be a good patient. I learned how doctors think and what kinds of things to track and tell your doctors, what kinds of questions to ask about health insurance, about medical terminology. So I understood what the treatment recommendations were and how to take the medications as prescribed. All of these topics are considered under the umbrella of health literacy. And I got to thinking, why had it taken choosing to be a healthcare provider and having 2 college degrees for me to learn how to take care of myself? And sure enough, when you look into the data, you find that only 12% of English-speaking adults in the US are considered health literate. So upon becoming a healthcare provider, having these ideas in mind, I made the conscious effort to provide these services to patients and realized that there was still a gap in the resources and time needed, which is where this project took its origins from. So while very few people are health literate, there are people, it exists on a spectrum. And the people most at risk for low health literacy are unfortunately also the groups that are systemically disadvantaged from other areas as well. And those include people who are non-white, immigrants and displaced individuals, people with less than a high school degree, people with lower than poverty level incomes, and non-native English speakers of English. And this becomes very important because poor health literacy leads to some pretty significant health consequences. So the research shows that there's an increase in preventable hospital stays, increased outpatient emergency department visits, medication errors in terms of taking your medications at the right time and the right doses, poor comprehension of nutrition labels, decreased adherence to treatments, inability to navigate the healthcare system, and most consequentially, mortality at its worst.
Now, as a native Washingtonian and a resident of DC for 25 years, let's take a look at some of these risk groups in DC, particularly within the context of Ward 7 and 8. Now, a ward is an administrative district that has an elected councilman. And to orient you to the wards of Washington, D.C., we've attached a map in the upper left-hand corner. And in the center, you'll find a map of D.C.'s Social Needs Index for 2021. And the Social Needs Index is actually a measure of need that is correlated with poor health outcomes. And the scale is ranked from 0 to 100, with 0 representing the greatest need. And if you take a look at this map, you'll see that zip codes within Ward 7 and 8 have some of the greatest need as indicated by the darker shading. And Ward 7 and 8 respectively house approximately 81,000 individuals, with approximately 92% of those identifying as Black, and roughly 3 to 4% of those identifying as being of Hispanic or Latinx origin. Particularly, Ward 7 constitutes 26.8% of families below the poverty line with children in DC. And Ward 8 constitutes 33% of these families. Simultaneously, residents in Ward 7 and 8 have the lowest insurance coverage amongst all wards. Taking a look at the map on the left of adults without health insurance, indicated by the dark blue shading amongst Ward 7 and 8, adults are between 10 and 13% of adults are going without health insurance. Also, residents in Ward 7 and 8 have some of the lowest life expectancy, as indicated by the red shading, with an average life expectancy of less than 75.8 years. And that is in stark contrast to areas like Ward 3, which are predominantly shaded green, which have an average life expectancy of greater than 78.5 years. So considering this data, as well as other indicators of poor health outcomes, we have identified an increased burden of unequal healthcare access, economic instability, and poor health outcomes within minority populations who use Medicaid within Ward 7 and 8. With our project, we believe that accessible and topic inclusive health literacy resources and curriculums will aid in addressing poor health outcomes among minority individuals in Ward 7 and 8. And particularly, we believe that providing individuals with a better means of communication will allow individuals to confidently comprehend, communicate, and self-advocate for their own care.
So knowing all this data, we looked at organizations in Ward 7 and 8, and this is the group of organizations that we ended up partnering with for our programming.
And so to carry out our project, we first engaged in community polling, and this involved social media surveys, as well as preliminary data collection through Google surveys, as well as those community conversations with those collaborators that Maya just mentioned. And we felt that was really important because these organizations were already on the ground, already engaged in this health work or health literacy work. We then proceeded into resource and curriculum development, and then eventually got to our launch, which was a two-part launch, where we launched our digital resources via Linktree, in mid-September. And we also have a series of workshops and classes in collaboration with our community partners. And since then, we've been focusing on data collection, really assessing our curriculum and workshop usage, our target population efficiency, and just overall ways how to improve both our resources and the reach of our target population. So we tried to create resources and curriculums for a range of ages. We have an elementary toolkit, a middle school toolkit, as well as an adult toolkit. All of the above contain medical planners, flexible 45 to 100-minute curriculums, and age-appropriate resources. And these resources are Kahoot games, there are worksheets, there are colorable printouts, there are situational skits, there are maps of clinics in DC that take Medicaid and serve Medicaid patients, as well as resources for parents. And one of the things that we really wanted to emphasize is that these resources have been adapted for digital engagement or print. So right now, since launching in mid-September digitally, we have 32 downloads across all of our resources. And right now, you're just looking at a very quick snapshot of our data from our elementary downloads, as well as our adult downloads. So just taking a look at this first row, the data is showing the zip codes of residents of our downloaders so far. And the zip codes that are actually fall within the DC lines have been mapped out in the upper left-hand corner for you. And what was actually very interesting about this data was the fact that a lot of these zip codes actually map to Southern Maryland within PG County. And that's very interesting because in 2019, the Washington Post actually noted that suburbs of DC, particularly those within PG County, have seen up to a 70% increase in their low income population since 2000. And that's significant because that actually tracks with the gentrification of DC. So it makes us think about our target population, particularly, do we need to expand our target population to include these zip codes? Or even more so, like, are we reaching our target population, but in a roundabout way as they migrate out of the city? So just continuing to look at some more demographic data within the adult downloads, all of the downloaders identified as Black, while the downloaders amongst the elementary school curriculum were a little bit more diverse, identifying as American Native and Alaskan Native, as well as identifying as being of Hispanic or Latinx origin. We also have downloaders that identified as immigrants. And though we lack some of that diversity amongst the adult downloads, we did see interesting things amongst the curriculum usage. And the majority of the downloaders wanted to use this information for themselves, but we saw some use amongst community organizations, particularly amongst back to church resources and for COVID vaccine initiatives and curriculums at Howard University College of Medicine.
And as Parris said, we have much more work to do, and we're excited to do it in the months and years to come. So coming up in November, we're going to be doing health literacy workshops, one at Ward 7's Fall Fest, one at Independence Now, which is an organization run by people with disabilities for people with disabilities, and one at Access Housing Inc., which is an organization that serves homeless veterans. We also have in the spring a health literacy workshop we're looking forward to at the Diplomatic Leaders Development Program. And we're also looking to be a part of internships with Howard University's Amharic program and Catholic University Spanish for Healthcare system courses in order to help translate our resources into other languages and also serve as interpreters at our events. We're also looking to expand our resources and also our workshops based on the data that we've tracked to make sure that it's reaching the populations that need it most. And we just want to say a huge thank you to Dr. Janine Abrams-McLean and Fair Count, as well as all of the funders of this program for giving us this opportunity to do this kind of work. And at this time, we are happy to field and hear some of your questions.